Welcome to BoxedIn Health, where knowledge meets wellness, sparking transformative journey to better you. Today we uncover the topic of heart attack. A heart attack happens when the blood flow to the heart is significantly reduced or obstructed. Typically, this occurs due to the accumulation of fats, cholesterol, and other substances in the coronary arteries, forming fatty deposits known as plaques. This gradual buildup of plaques is referred to as atherosclerosis. On occasion, a plaque can rupture, leading to the formation of a clot that obstructs the blood flow. This interruption in blood supply can cause harm to or even destruction of a portion of the heart muscle. During a heart attack, a lack of blood flow causes the tissue in the heart muscle to die. A heart attack is also called a myocardial infarction. Heart attack symptoms can vary, and their intensity ranges from mild to severe, or some individuals may experience no symptoms at all. Typical signs of a heart attack include chest discomfort that can manifest as pressure, tightness, pain, squeezing, or aching. Pain or uneasiness spreading to the shoulder, arm, back, neck, jaw, teeth, or sometimes the upper abdomen. Cold sweats. Fatigue. Heartburn or indigestion. Feeling lightheaded or experiencing sudden dizziness. Nausea. Shortness of breath. In some cases, women may encounter atypical symptoms such as brief or sharp pain in the neck, arm, or back. Occasionally, the initial warning of a heart attack might be sudden cardiac arrest. While certain heart attacks occur suddenly, many individuals experience warning signs and symptoms hours, days, or even weeks before the event. Persistent chest pain or pressure, angina, that doesn't alleviate with rest could serve as an early warning, signifying a temporary reduction in blood flow to the heart. Most heart attacks are a result of coronary artery disease, where one or more of the heart's arteries, coronary arteries, become obstructed. Should a plaque rupture, it can trigger the formation of a blood clot in the heart, potentially leading to a heart attack. A heart attack can occur due to either a complete or partial blockage of a coronary artery. One way to categorize heart attacks is based on whether specific changes, ST elevation, appear on an electrocardiogram, ECG or EKG, indicating the need for immediate invasive treatment. Your healthcare provider may utilize ECG results to characterize these types of heart attacks. An acute complete blockage of a medium or large coronary artery typically signifies a ST elevation myocardial infarction, STEMI. A partial blockage often indicates a non-ST elevation myocardial infarction, NSTEMI. However, some individuals experiencing NSTEMI might still have a total blockage. It's important to note that not all heart attacks stem from blocked arteries. Alternative causes include coronary artery spasm, a severe contraction of a blood vessel that isn't blocked, often occurring in arteries with cholesterol plaques, or early hardening due to risk factors like smoking. This condition is also known as Prinzmetal's angina, vasospastic angina, or variant angina. Certain infections, conditions like COVID-19 and other viral infections can inflict damage to the heart muscle. Spontaneous coronary artery dissection, SCAD, a life-threatening situation resulting from a tear inside a heart artery. Risk factors for a heart attack include age. Men aged 45 and above and women aged 55 and above face a higher likelihood of experiencing a heart attack compared to younger individuals. Tobacco use. This encompasses both smoking and prolonged exposure to second-hand smoke. Quitting smoking is essential to mitigate this risk. High blood pressure. Over time, high blood pressure can harm the arteries leading to the heart. The risk is further amplified if high blood pressure coexists with conditions like obesity, high cholesterol, or diabetes. High cholesterol or triglycerides, elevated levels of low-density lipoprotein, LDL, cholesterol, often referred to as the bad cholesterol, significantly contribute to artery narrowing. Increased levels of certain blood fats known as triglycerides also elevate the risk of a heart attack. Maintaining standard levels of high-density lipoprotein, HDL, cholesterol, the good cholesterol, can lower the risk. Obesity. Obesity is associated with high blood pressure, diabetes, elevated triglycerides and LDL cholesterol, and decreased levels of HDL cholesterol. Diabetes. Elevated blood sugar levels due to insufficient production or utilization of insulin in the body increase the risk of a heart attack. Metabolic syndrome. This involves a combination of factors like abdominal obesity, high blood pressure, low levels of good cholesterol, high triglycerides, and elevated blood sugar. Having metabolic syndrome doubles the risk of developing heart disease. Family history of heart attacks. If a close family member, parent, sibling, or grandparent experienced a heart attack at an early age, the risk of having a heart attack is heightened. Lack of exercise, inadequate physical activity and leading a sedentary lifestyle are linked to an increased risk of heart attacks. Regular exercise is beneficial for heart health. Unhealthy diet. A diet rich in sugars, animal fats, processed foods, trans fats, and salt escalates the risk of heart attacks. Conversely, a diet abundant in fruits, vegetables, fiber, and healthy oils helps mitigate this risk. Stress. Emotional stress, especially extreme anger, may elevate the risk of experiencing a heart attack. Illegal drug use. Stimulants like cocaine and amphetamines can induce a coronary artery spasm, potentially leading to a heart attack. History of preeclampsia. Preeclampsia, characterized by high blood pressure during pregnancy, increases the lifetime risk of heart disease. Autoimmune conditions. Having autoimmune conditions such as rheumatoid arthritis or lupus can heighten the risk of a heart attack. Complication. Complications arising from a heart attack often stem from damage to the heart muscle. Potential complications include irregular heart rhythms, arrhythmias. Heart attack-induced damage can disrupt the heart's electrical signaling, resulting in abnormal or dangerous heartbeat patterns. Some of these arrhythmias can be severe and life-threatening. Cardiogenic shock. This rare condition occurs when the heart suddenly and drastically loses its ability to effectively pump blood. Heart failure. Extensive damage to the heart muscle can render the heart incapable of pumping blood efficiently. Heart failure can be temporary or chronic, depending on the severity of the damage. Inflammation of the heart's surrounding sac-like tissue, pericarditis. Occasionally, a heart attack can trigger an immune system response, causing inflammation of the sac-like tissue around the heart. This condition may be referred to as Dressler syndrome, postmyocardial infarction syndrome, or postcardiac injury syndrome. Cardiac arrest. This occurs when the heart abruptly stops beating without warning. A heart attack increases the risk of experiencing this life-threatening condition, which can lead to sudden cardiac death if not promptly treated. It's important to understand that it's never too late to make changes that can significantly lower your risk of experiencing a heart attack, even if you've already had one. Here are some steps you can take to prevent a heart attack. Adopt a healthy lifestyle. Quit smoking if you do. Maintain a healthy weight through a heart-friendly diet. Engage in regular exercise, and find effective ways to manage stress. Manage existing health conditions. If you have conditions like high blood pressure or diabetes, proper management and regular checkups are crucial as they can elevate the risk of heart attacks. Adhere to medication plans. Follow your healthcare provider's instructions and take prescribed medications to safeguard and enhance your heart health. Additionally, learning CPR can be incredibly valuable, enabling you to assist someone experiencing a heart attack. Consider enrolling in a reputable first aid training course that covers CPR and the usage of automated external defibrillators, AEDs. Being prepared and knowledgeable can make a difference in saving a life during a critical situation. Hope you get all the information regarding your heart health. Do like, share and subscribe for more informative content. Thanks for watching. See you with another video.